So you've come in about your snoring, but it's very interesting that most patients who are coming in for snoring also have some symptoms of sleep apnea. But a lot of our patients are coming in because they've actually been diagnosed with sleep apnea and they all snore as well. So it's, both snoring and sleep apnea are actually caused by the same thing, which is a narrowing of the airways, not allowing enough oxygen into the lungs while you're asleep, causing us to take a deep intake of breath. But when we're snoring and our tissues are all relaxed, that comes out in a snoring noise instead of a big deep intake. So snoring obviously causes a lot of problems at home. Wives get upset, they can't sleep well, they give you the digs in the ribs, which is always annoying. But also you wake up feeling crappy the next day because you haven't had enough good quality sleep and you haven't sort of been really rested through the night. And obviously with symptoms of sleep apnea, that can be even more severe, and patients really can often report feeling a lot of difficulty in getting through the day at work without being tired and really struggling through the day, low concentration, but also it can really impact other serious health outcomes, so things like blood pressure, heart disease, those kinds of things, so it can be quite serious, hence why we need to address it. Now, so far there's only a couple of options that have been available before this groundbreaking SleepTight treatment. Previously is a CPAP machine, which is a machine that forces oxygen into the lungs. Have you come across that at all?
Yes.
Yep, and it's quite intrusive, and a lot of patients who have used it successfully still end up coming to see us because they find it is really intrusive in the night. And then the other thing is the mouth guard, which I'm sure you've also heard about, which needs to be fitted properly and again can be quite uncomfortable and cause a lot of jaw pain because it forces the jaw forward to move the position of the tongue while you're sleeping. Both those things are reliant on you actually using them every single night. So they can be quite difficult when it comes to wanting to travel and not having to wear a device in bed. Now SleepTight's very simple. It's 3 20-minute treatments that we do with a laser here at the clinic, and when it's done the treatment starts to work over the next 6 to 7 months, so you don't need any devices or any other things to maintain the results.